Good afternoon, Miss Barami.
Good afternoon, my lord. Our next witness today is Eleanor Bates of the Scottish Healthcare Workers Coalition, and her witness statement reference for the record is SCI WTO 462501.
Very good. And I can now see you. Good afternoon, Miss Bates.
Good afternoon, my lord.
Right, now I think we're ready to go. You'll be asked some questions by Miss Barami. So when you're ready, Miss Barami.
Thank you, my lord. Good afternoon, Ms. Bates. At paragraph 13 of your statement, you tell us that at the end of March, you told us that at the end of March 2020, your father had a stroke and was admitted to hospital in England where he lived with your mother. He sadly died 2 weeks later, and you were unable to visit him during those 2 weeks. Please, would you tell us why you were unable to visit?
Good afternoon, Miss Barami. At the time when my father was admitted to hospital, I was very unclear about the visiting rules and what I should do. So there wasn't any testing available at that time, so I couldn't be sure that I was free of COVID myself. So I wasn't sure if I went down, I could infect my mother as well, or if I went down, I would prevent my mother from being able to see him in hospital. So for both those reasons, I chose not to travel down until he actually sadly died. And then when he sadly died, I spoke again to the COVID helpline and asked if I could travel down, and chose to travel down at that point.
Thank you. Is it your belief that there wasn't, that enough consideration wasn't given to cross-border travel at that point?
I don't know if it was something anybody really thought about at the time. You were very much getting reports for England and for Scotland separately, so I'm not sure. I don't remember anything about governments explaining or thinking about what would happen if you needed to travel across the border at that time.
Okay, that's an area that you think greater thought should be given to
Certainly,
in future.
I certainly think it's something that should be given thought to. In future situations like this, we need to think about people who need to cross the border, as well as travel within your own nation.
Thank you. Now, moving forward in time, on the 11th of January 2021, you took a PCR test which provided a negative result for COVID, but you had symptoms, and a few days later, your symptoms became worse and you contacted NHS 24. Can you please tell us about your symptoms at that time and how you came to find out that you had COVID?
So my symptoms at that time, I had a certain level of shortness of breath. I had chest pain and level of breathlessness. I spoke to NHS 24 and they weren't concerned that chest pain was serious enough that I needed to attend A&E. And because I thought I was starting to recover, I didn't go for a further PCR test, but I still wasn't better really about 3 to 4 weeks later, although I had got to work the following week, working from home. So about 4 weeks later, I undertook privately an antibody test, and that proved positive for COVID with 2 different types of antibodies.
Thank you. And then can you tell us how your symptoms continued, and as a consequence of those symptoms, what medical assessments were carried out?
So there were a number of, it was 1st of February I took the antibody test. Between the middle and end of February I talked to my GP because I was getting ongoing chest pain, breathlessness and increased heart rate when I stood up. I had at that point a finger-based monitoring device that I could tell, and also later a smartwatch which could tell. When I saw my GP I was assessed for myocarditis, but the symptoms weren't considered severe enough for referral to A&E. So at that point, I was referred for an ECG into cardiology. That was around middle to end of February. By 25th of March, I had an ECG appointment when tachycardia was detected, so that's a heartbeat of 100 beats per minute, and a subsequent referral for 24-hour monitoring. There's quite a long list, so do you want me to, at what point, how far do you want me to carry on with the sort of progress of symptoms here? I can sort of carry on sort of reading through until sort of July 2022, or would you like me to stop at this point?
Well, I think that's fine for now. I think there came a point where you, on the 31st of March, self-referred to occupational health.
That's right, yes, yes.
But at that point, they told you that there wasn't anything, any services available that could help you. Is that correct?
There was no specific support for long COVID or post-COVID symptoms at that stage. They did refer me to the public online support, and I also had spoken to the chest, heart and stroke helpline, but there weren't any specific services at that point available for people with post-COVID symptoms who were recovering at home.
Yes, thank you. And then on the 6th of July, you received your ECG results, and they were normal.
That was the echocardiogram, actually. By that point, I'd had an echo done as well to check that my heart rate. So, yeah, 6th of July, I got ECG back as normal. By July, I had low iron levels in the blood.
Yes. And in June, you had a womb ultrasound carried out.
That's right.
And the results of that concerned your GP enough for your GP to make an urgent referral? Is that
to gynecology,
correct?
that's correct, yes, because I was getting very heavy bleeding, which was unexplained.
Yeah. And then in July 2021, you again tried to self-refer to occupational health.
Yeah.
Were they able to provide you with any assistance at that point?
They were very empathetic and kind. They were really kind to me, but and really sort of thoughtful. But what I was hoping for is there might be some physio advice about how much exercise I could do, or access to specific physio recommendations. And unfortunately, that wasn't available for people with post-COVID symptoms or long COVID. And as I say, there was no specific physio help available at that stage for this condition. Again, they were very thoughtful, sort of told me to rest, take it easy, take breaks, that kind of thing. But there wasn't any specific physio advice I could access at that stage.
Thank you. And by September 2021, your cardiology issues continued, but you still hadn't heard from an NHS cardiologist, so you attended an appointment with a private cardiologist instead.
Yeah, I'd actually arranged that across August, because by that point I'd been reading information up online, and I suspected that my symptoms were typical of posterior orthostatic tachycardia syndrome, where your heart rate does go fast when you stand up. So I spoke to a private cardiologist who said that yes, they suspected I did have that, but there would potentially be further tests I would need to confirm it.
And is that all that happened at that appointment? He told you that this was a potential, or
yes. At that point, it was labelled as suspected posterior tachycardia syndrome. And I was sort of given some general advice about what I might be able to do, told to get back in touch. And because I was still waiting to speak to cardiology, there was various tests suggested. I can't quite remember the exact order of things, but I know that he was suggesting a tilt test and a 6-minute walk test. And before I did actually get those in September time.
Yes. Thank you. And on the 8th of September, you again tried to self-refer to occupational health, and at that point, they again told you they couldn't assist and recommended you reduce your working hours.
That's
that
right.
correct?
So yeah, by that point I was still getting incredibly tired, and I was still also having issues with the heavy bleeding. So at that point I reduced my working hours. They had been 30 hours a week, so I then reduced them to 22 and a half days a week, effectively 3 days a week.
Yes. And then since then, that's what you remained on, is that right?
Yes, I made that permanent in February 2022, and it was clear I wasn't getting better.
Thank you. Then later in September, you were finally contacted by an NHS cardiologist. Can you tell
Yeah.
us about the assessment which followed that and the diagnosis, if any, that you were given?
Right. So at that point, when I spoke to them, they agreed that it was likely post-viral symptoms of COVID-19. I can't remember if long COVID was specifically mentioned, but the results of the tilt test were slightly ambiguous. And although my heart rate had gone incredibly high when I did the 6-minute walk test, I mean, higher than it should for standard of somebody of my age, very, very high, and I've become very, very breathless, they weren't able to diagnose POTS, and the cardiologist was saying it was not really a particular area of their expertise. They thought it was possible I might have an unusual version of POTS, but they weren't exactly sure exactly what it was. So they weren't prepared to offer a diagnosis at that point. And I think it was kind of left, as a lot of professionals were saying at the time, we didn't know very much about COVID still at that stage, so it was, well, maybe you'll get better with time.
In your experience, was there general uncertainty among physicians about the long-term consequences of COVID-19, and in your case, which of your symptoms might be part of that ongoing effect?
Yes, I mean, in my case specifically, because I had this heavy bleeding and I still hadn't got to see anyone from gynecology at this point, despite the urgent referral in July, they couldn't tell whether my symptoms, which were a key one was chronic fatigue, were actually due to the fact I was getting very heavy bleeding and had low iron levels, or whether it was due to these post-COVID symptoms and this very high heart rate. So it was, I think, quite difficult to determine between the two. I'm also in my 50s, so I'm a menopausal woman, so I think there was a lot of uncertainty about precisely what might be underlying these symptoms at the time, which I understood.
Yeah, thank you. And in January 2022, when you made inquiries, you were told the waiting time to see an NHS gynaecologist was over 40 weeks.
That's right. I've been ringing them regularly to see how long is the wait list, and when I got to January, I was told the waiting list was still 40 weeks.
40 weeks. That you were told that in typical times it had been 12 weeks.
Yes, but my GPs were terribly apologetic to me about this. They were saying, look, normally you would see someone within about 12 weeks for these kind of symptoms.
Yeah, thank you. And your gynecological symptoms continued to worsen, and
yes,
as you mentioned, that led to you in February permanently keeping your work hours
yes,
to 22 and a half per week.
Yes, that's right.
And on the 21st of February 2022, you attended a private gynecology appointment.
Yeah, I'm very reluctant. Sorry, I didn't mean to interrupt you. Please go ahead.
No, sorry, you continue.
No, yes, on that date I attended a private gynecology appointment because by that point I was very, very concerned about my symptoms, and I was concerned if they didn't get better I might have to reduce my working hours further and I would get more sick. And I guess I was a bit scared by them too. I didn't think it was some form of cancer, but I didn't know for sure, so I was a bit scared by them too, I think. Yes. So by that point I went to a private appointment, which I was very, very reluctant to do because I'm a big supporter of the NHS, so it wasn't something I did lightly, but I wanted to see if I could get better.
Yes, thank you. And can you tell us what happened at that appointment and what, if any, diagnosis you were given?
So that appointment, I can't quite remember the exact order of things. I think it's perhaps a bit more detailed in my statement, but following an initial appointment, I was then given a further ultrasound. That ultrasound found a polyp, or well, I should have knew if they knew it was a polyp at that point, but there was definitely something that needed urgent investigation and a medical procedure. to do that investigation was discovered through the ultrasound. So it was established that something needed to be looked at as a matter of urgency.
Thank you. And you subsequently received private treatment for that, which...
That's right.
Yeah. And that resolved your symptoms by May 2022?
Correct, yes. So I had private treatment in April, and that resolved the symptoms. And I think they were pretty much completely resolved with almost immediately, and certainly within 4 to 5 weeks after that treatment.
Thank you. And just before that resolved in March 2022, you again self-referred to occupational health, but again nothing was available for long COVID, is that correct?
Yes, specifically for the Special Health Board I worked with, and the NHS body that provided our occupational health services, they still didn't have any specific long COVID services for staff at that stage. Again, the occupational health people I talked to were extremely supportive, very sympathetic, told me to take regular breaks and rest, make sure I was, pacing myself carefully, those kind of information, but there still wasn't anything specific for long COVID at that stage.
Thank you. And then in July 2022, you tested positive for COVID again?
Yes. Yeah, unfortunately, I contracted COVID again at a social event. I hadn't actually been out to socialise for months, for a very, very long time. And yes, unfortunately, I caught COVID a second time.
And consequently, you sought antiviral medication from your GP.
Yes.
But you, and then enrolled for an antiviral drug trial. Could you tell us about those, please? Contacting your GP and the trial.
So because I already had COVID and part symptoms, I was quite concerned that the second COVID infection might make me worse. So I approached the GP to see if there was any possibility of accessing antiviral treatment, and it wasn't available to people who'd had COVID infections before, people like me. So I couldn't access that, but I did find out there was a trial running within my health board area that I could sign up for. So I did sign up for that, and unfortunately I was randomised to the arm that didn't meant I got the antiviral treatment. So I didn't receive any antiviral treatment. Instead I got what was called support, which basically meant I got to chat with a nurse about my symptoms, which was again very nice, kind and supportive, but I didn't get any treatment. And it also meant I got a couple of PCR tests at that time, which proved that I actually had COVID, and I was infectious, I think, for about 2 or 3 weeks. So I was actually quite ill, not needing to be hospitalised or anything, but really not very well for about a fortnight at that stage.
And by the end of July 2022, you struggled with work owing to exhaustion and tried to self-refer to occupational health again.
Yeah, at that point, because I'd had some time off sick, it was decided it had to work rather than just work as a self-referral, because my managers have been incredibly supportive. So I'd never had a management referral to occupational health because they hadn't been sort of concerned I could do my job as such in that needed a management referral. But in this case, because I'd been absent, it had to be done as a management referral. So that was then done as a management referral. But my managers throughout this were nothing except supportive. They were incredibly supportive of me.
And then you were off work for a week following that
referral?
Yeah,
I went back off work. So I was off work, I think, for about a fortnight, 2.5 weeks. I tried to go back, which I probably shouldn't have gone. Then I was back off work again. And then I went back on into work via a phased return, which was a 4-week phased return, I think. So I was working less hours as I was going back across that 4 weeks phased return. So yeah, it was, and I was keen to get back to work to support my colleagues, because obviously we were doing work to assist with the COVID pandemic back office work. So I wanted to be back in there and supporting my colleagues in doing that work.
Yes, and that phased return started on the 2nd of August. But during that period and following the phased return, you were trying to balance work with helping your mother, who still lived in England, and that led to you subsequently being signed off work from the end of September until January 2023. Would you like to tell us about that?
Yes, so basically I'd got to the point where I was feeling very, very stressed and burnt out by a combination of having COVID for the second time, feeling I wasn't able to do my job properly because I still wasn't well, and I had this incredible fatigue and I was struggling to concentrate, and so I was really stressed about that. I was also driving long distances about every 10 weeks to assist my mum down where she lives, so I could just help her out with various sort of things like shopping trips and stuff like that, and general sort of support, and just being there, so she wasn't by herself. So I was doing that, but I was really struggling to do all of that, having not been well, and even though I was supported by my husband to go down and stuff, it was incredibly tiring going down at that particular moment in time. So I think a combination of all those factors and the fact that there still wasn't sort of any sort of clear medical support as well for the condition, I was just feeling very stressed. I didn't know when I was going to get better. I didn't know if I was going to get worse. And all of that led to me being officially signed off for mental health reasons, although I think it really was a mixture of long COVID and mental health reasons. When I talked to the GP about it, I actually remember the GP saying, "Are you happy with being signed off for mental health?" And I thought, well, it's probably a bit mental health and a bit on COVID, but I'm happy for it to be labelled as that. But I think more than anything, I was just very burnt out at that point.
Yes, thank you. Then in late December 2022, an NHS cardiologist wrote to your GP advising that they were unable to assess long COVID patients because you still had a referral outstanding. They were unable to assess long COVID patients who didn't have a serious cardiac condition. The cardiologist suggested a medication for your GP to prescribe to you, but you tell us that that didn't happen because your GP omitted to inform you of the letter. When did you become aware of that letter, and were you then prescribed the medication?
So I actually became aware of that letter in about January 2023. Yes, we are in 2023. I'm trying to get my year. Yes, but January 2023, because I'd rung up my GP because I'd actually decided to go and get a private cardiology appointment to find out if I could get a POTS diagnosis and try and work out what was happening with that. And my GP was incredibly apologetic and said, actually, we've had a letter saying from cardiology suggesting a possible medication. And at that point, I said, well, you know, because you can do shared care with private healthcare, the GP, are you happy for me to go and see the private cardiologist, which I did do. And so I would then saw a private cardiologist round about, and by sort of February, March time, I did finally get a diagnosis of hyperhidrogenic POTS, which is a type of POTS where your fight or flight system gets overexcited, I guess, and your heart rate goes very high very easily, and it will go high on standing, but it also can go very high if you're at all stressed in any way. And I was, in fact, suggested a medication by the private cardiologist, was actually the same medication as the NHS cardiologist had suggested back in January. And at that point, I went on to that medication, which I did find very helpful.
Thank you. And just prior to having a couple of months prior to the private cardiology appointment in January 2023, you saw finally an occupational therapist to discuss a 4-week phased return to work.
Yeah.
Is that correct? But there was still no long COVID specific treatment at that point.
Correct. So again, I spoke to occupational health. I don't think it might have been occupational. I mean, some of my occupational health before that may have been with occupational therapists. Some of them would have been with an occupational health nurse, I think. Okay. I couldn't tell you exactly what the qualifications were of the various people I saw, but the occupational health, yes. So I talked to occupational health again about phased return, and it was this sort of usual phased return advice: pace yourself carefully, that sort of thing. But again, yeah, no specific long COVID physiotherapy support, no specific long COVID support was available to people by my employer at that stage, nor was it available via my health board at that stage.
Yes. Then again in July 2023, you sought referral by your GP to a long COVID service. Could you
Yes.
please tell us about that and the subsequent referral?
Yes, so in July 2023, I saw referral to long COVID service because I'd heard that one had actually started in my area around about April of that year, and I thought it had been phased out to my area in about June that year. But when I asked the GP in that stage, they didn't know it was happening and said they didn't think there was one in the area. And then I spoke to Occupational Health again in August, and they said, actually, I'm sure there is a service in your area. And I double checked it, and again, Occupational Health being as helpful as they possibly could, actually sent me details of where the health board related my health board as a resident available service was available, and I was able to go back to the GPs. I think I just did it via a phone call to the reception and said, I think the service does exist. This is the service. Please, could you get me referred? Which they did do in August of August 2023.
Thank you. Please could you tell us about the support you received from your employer in respect of COVID-19? Long COVID.
I would say that my managers were extremely supportive. They were very supportive of me working less hours. When I had returned on the phased return, I had some responsibilities taken off me. So I was able to sort of work less hours. We work very flexibly anyway, so we work flexi time anyway. But I would say throughout, my line managers have been excellent in the way that they have enabled me to work flexible hours, to flexibly swap hours around if I'm having a day when I've got less energy. So I would say that the support from my managers and my employer has generally been very good. What I haven't had access to is dedicated courses or support around long COVID. Certainly not until this year through my health board, but up before that wasn't available. But yes, I would say generally my managers did everything they could to be supportive by being flexible, by letting me work flexibly. So I would say that generally they were very supportive.
Thank you. And can you tell us about the support and treatment you've received from your health board? I think it started in February this year.
Yes, so I finally received support in February 2024. That's been, I think it's an 8-week course where they cover various parts of long COVID symptoms and you get assessed. And I've also now had a series of ongoing appointments with a physiotherapist who is now finally talking to me about what physical exercises I can do with the condition I have, which is excellent. What I wanted to access about 2 years ago, so I'm incredibly grateful that I'm getting there. What still isn't there, which I think is lacking and is a real gap in the service, is that the service doesn't have clinician oversight. So it doesn't have a prescribing doctor that oversees the service, which means that the service isn't able to give me any advice about prescriptions at all or what levels of drugs I take. If I want that, I have to go back to my GP, and then my GP then has to write to cardiology. And because I'm not under any kind of consultant, because in our health board there doesn't seem to be any consultants who are specifically taking responsibility for long COVID, as far as I'm aware, that doesn't seem to be in place even now. The service is excellent in terms of the support I've had from the allied health professionals in this service. They've been really helpful, and it's really great that I'm now getting access to this physio level of support. But as far as I can see, there's still no clinician oversight. And that's very different to another health condition I have, which is a skin condition, where I get to see a consultant about every 6 months or every 12 months. And if I've got any issues about things that I could be prescribed, I can discuss those with the consultant and I can get access to prescribing information. With long COVID, it's still very unclear what I can do about accessing medication and who I go to for advice apart from my GP. And when I've been to my GP clearly says, because I don't expect them to be an expert, I'm not an expert on this, I'm not an expert on the particular medication you're taking, so I'm not quite sure what to do. So it's still, I think, a bit unclear when it comes to prescribing. I think the physiotherapy support is there now, but at the moment there still doesn't seem to be a consultant-led service there, which I think is a gap.
Yes, thank you. Then in paragraphs 87 to 91, you talk about long COVID services. Am I correct in deducing your view to be that services are fragmented and much depends on what a particular GP or GP practice has awareness of?
Yes, I think so. I mean, that would be, I can't comment on wider services and outside of my own experience, but I would say I, like most people, I very rarely see the same GP at my practice. So I don't have a dedicated person who even knows about my own symptoms at my GP practice who I get to speak to about this. So every time you see someone, you have to re-explain what your symptoms are and where you're at and what your condition is. And beyond that, it's, as I say, there's lots of different health professionals you can get referred to. My partner also has long COVID and has been sent to different specialties to me before finally getting referred to the long COVID service. So yes, I would say in my experience, there doesn't seem to be any central point for services. It seems quite unclear where you go. At certain points you need to go for private expertise because there still doesn't seem to be internal expertise. So yes, I think fragmented would be a fair word.
Thank you. And you tell us that accessing private treatments due to NHS waiting times has cost you £4,000. Is that correct?
About that, I mean, I think in total, I think it was around 3,000 on the gynecological treatments and around £1,000 on the cardiology things. It might be not quite that balanced, but it's something like that. Arguably, I could have not gone to private cardiology. I could have just used NHS cardiology, but if I think I'd have done that, I just don't think I'd actually have a diagnosis of postural tachycardia syndrome. And for me, having that diagnosis has been very helpful because it then can help me understand what I should and shouldn't be doing to manage the condition. So I think probably in both cases, certainly the gynecology private treatment, I think made such a difference to me in my quality of life. I have no regrets about doing that. But yes, the amount is about £4,000. I would say I'm very fortunate we had savings, so I was fortunate to be able to access that, and I very much feel for people who didn't have the opportunity that I did to pay for private treatment. Yeah.
Thank you. And finally, in paragraphs 95 to 100, you talk about the impacts of COVID-19 on you. Please would you tell us about the impacts on your career and your personal life?
Yes, so I mean my main symptoms are fatigue and poor concentration, and as you can hear in my voice, if I talk for more than a certain amount of time, I start to croak, and so my stamina to have a 30-minute meeting is not what it used to be. So before I got to COVID, before I had COVID, I contracted COVID, I was hoping to look at promotion and to move to a more senior position. I'm currently an NHS Band 6 and I was considering moving to a Band 7 post. And at the moment that's very much on hold because I have no idea if I could work at a higher level. I've lost a lot of confidence in my ability to do a job that would involve a lot more meetings and a lot more kind of multiple things at once, which perhaps a senior role would be. So it's very much put at a hold any career aspirations that I might have had. I frequently, even though I'm pacing better, and I think I'm doing a bit better since I've seen the service in February 2024, I definitely think things are improving a bit, but I still quite often feel burnt out and exhausted. I'm always trying to offset what I use my time for because I'm working 4 days a week. It's only 22 and a half hours, but across 4 days a week I take a break on a Wednesday because I'm spreading my hours out. By the time I get to the evening I'm absolutely exhausted, so I don't get to go out in the evenings. I very rarely see friends. I don't really have a social life. I mean, I wasn't perhaps not the most social person. I do still a little bit of online socialising, but actually seeing people in person is extremely rare. I think I saw someone in person for a coffee for the first time ever last week. I say first time ever, first time in 12, 18 months maybe. Then I was quite worn out afterwards. There's a sort of energy debt thing in that you run out of energy. You're always trying to work out, where do I put my energy? Because I put my energy into work and I haven't got energy for other things. And also I'm still driving distances to support my mum as well. So it's just a question of sort of how do I have, because I've got such limited energy now, it's kind of where do I put that? And yeah, at times I can feel quite sad, quite lonely. I think I'm feeling a little more hopeful than when I first gave the statement back in February, because of the access I've had through the service recently. I think that's given me a bit more kind of confidence that maybe there are ways to manage my symptoms, which I didn't have 2-3 months ago when I made the statement. But yeah, at times it's very hard.
Thank you. Now we have your statement, and we will consider everything that's contained within it alongside your oral evidence today. Is there anything that we haven't discussed today that you would like to highlight at this point?
My personal view is that for long COVID patients, from my personal experiences, it would be incredibly helpful if we had consultant-led services. I also have been surprised at how little support there seems to be for conditions like POTS within Scotland. There doesn't seem to be any service, a centralised service for things like dysautonomia, POTS, MEC, FS. There's no specific expertise. There's no, I know usually we don't have national services in Scotland for this kind of thing, but maybe a centralised service. There are services in places like Northumbria and Newcastle who have something called the Cresta Clinic with multidisciplinary services that are sort of physician-led with consultant-led services. So it still feels like there's a real gap there around support for people with chronic conditions and post-viral conditions. And I think going forward, one of the lessons we can learn from COVID is that, a virus can affect lots of people. Lots of people can end up with these really unpleasant post-viral symptoms. And I think it would be really good if we have support services for common complications like dysautonomia and POTS there for people in Scotland. And as far as I can see at the moment, we don't really have services in place dedicated to support that. I think it's a big gap. It'd be good if we could have something in place to help people.
Thank you very much.
Yes, thank you, Ms. Bates. That's all. Very good, thank you, Ms. Barami. Now, we've finished early, which is fine. I understand that the next witness is here, as is Mr. Dunlop, who's going to take that witness. So we'll have 15 minutes from now, or actually 17 minutes from now. We'll come back at 2:25 past. Thank you very much indeed.
Thank you, my lord.
No. Good afternoon, Mr Dunlop.
Good afternoon, my lord. This afternoon we have Mrs. Sara Redmond, who we have the benefit of her evidence hearing it for a second time. So, and her witness number for your own records is SCI WT 0584, then 5 zeros, and then, as it's the second occasion, number 2.
Ah, okay. Thank you very much, and good afternoon, Mrs Redmond.
Good afternoon.
Right, ready to go?
Thank you, my lord. Good afternoon, Mrs Redmond. As I've just indicated, you previously kindly provided evidence to the inquiry back on the 1st of November. I think it was in the first week of the inquiry impact hearings last year in relation to a number of issues, including long COVID, shielding and so on. For the purposes of today's evidence, I understand that you've, and I have it before me, you've prepared a supplementary statement dated the 28th of February addressing in detail the impacts of the pandemic on unpaid carers. Is that correct?
That's correct.
Thank you. And I have that supplementary statement in front of me, and it should be up on your screen. And it runs to 102 paragraphs in length and has a number of footnoted documents, but we won't be looking at those today, just your statement. Looking at your statement, you provide us with some details about the Alliance in paragraphs 1 to 4 of your supplementary statement, and I don't propose to look at those given that you've given evidence earlier. I wonder if I can just jump forward to paragraphs 7 to 9, and you tell us that the Alliance supports unpaid carers. What in particular can you tell us, what type of support does the Alliance provide to its members and unpaid carers?
So we provide a range of different programmes of work. Centrally we're a membership organisation, so people who are providing unpaid care can sign up as a member of the Alliance, can get involved in our policy and campaigning work. They can respond to consultations that we're submitting on behalf of our membership, and directly and in that way have a say around policy changes, strategy and service changes around health and social care. We also deliver a range of programmes of work as well. So the only service that we provide is the Community Links Worker programme. So through that service in particular, there will be direct support provided to people who are in a caring role within their home life and in a unpaid role, where they might be experiencing some challenges to their health and well-being that are not medical or clinical but are more to do with their social and emotional well-being, and they are provided with one-to-one support through the Community Links Worker. They are then also provided with routes into community sources of support as well. And then through other opportunities we have a funding stream, so we can invest in approaches that support people to live well in the community, and we have through that funding stream invested in different unpaid carer organisations. So there's a range of different ways in which we kind of try to support people.
Thank you. One of the things, when you started the answer, you said it's a membership organisation, and it might be helpful, you identify later in your statement, I think at paragraph, well, you identify later in your statement that you have 3,500 members. Of those 3,500 members, are they all organisations or are some individuals?
Yeah, so a mix of both. So we are constituted to have our standard membership will be organisations and groups. So it's only those standard members that can be on the board of the Alliance and support with the governance. But we also have a range of individual members. So that will be people who are unpaid carers, disabled people, people living with long-term conditions. And then we also have associate members who will be people working in health and social care, and organisations such as health boards, health and social care partnerships can also sign up to be an associate member.
Okay, thank you. And the other thing you mentioned the Community Links programme, but I think you deal with that later in your statement, so we'll come to that in due course. At your paragraph 11 of your statement, you identify that there are 30,000 young carers in Scotland alone. Just firstly, when you talk about a young carer, is there a particular definition? Is it between certain ages?
My understanding is that it's up to 25, so up to that age range, so anyone within that age range. And I think it, it is an estimate around the numbers, partly for the reasons that are, others have possibly spoken about as well, that not everyone will identify themselves as a carer.
And do you know if the number of young carers during the pandemic increased, decreased, or stayed the same?
So from the evidence we've seen, it has increased. I think overall it was estimated to have gone up from around 800,000 to around 1 million people who were involved regularly in unpaid caring.
And that would be within the UK then?
That was just within Scotland.
Okay. Sorry, but young carers,
no,
dealing with young carers?
So for young carers, I'm not sure. I've not seen any evidence of whether that went up.
But in terms of just carers generally, you saw an increase of from 800,000 to 1 million. What was the cause of that increase?
So I think there were many reasons. It was multifaceted. For some people, where they, someone was experiencing the effects of long COVID, for example, it was maybe a new condition that they were experiencing because of the onset of the pandemic. They were, catapulted, I guess, into an unpaid caring role. For other people, it was perhaps a change in circumstance. So maybe, we heard of some people where they were perhaps, a loved one was receiving support, like more formal support through services, but because of the risks that they felt that presented for a family member, they then ceased that support and provided it in a more informal, unpaid caring role. And I think for other people as well, there was just a worsening of the health conditions that their loved ones were experiencing because there was a reduction in health services.
Well, that was the question I was going to ask you. Were some people, did they become accidental, if you like, unpaid carers because there wasn't the level of services that had been there pre-pandemic?
Yeah, we did hear that quite a lot from people through our engagements, that the way in which services were stopped, particularly health services, so that they were prioritised for the direct response of people who were diagnosed with COVID, that it meant that for many people the health services that they were relying on were suddenly stopped at a moment's notice.
And as we've come out the pandemic, some people might say we're still coming out the pandemic, but as things have improved, has the number of unpaid carers, is that reduced back down to pre-pandemic levels, or has it stayed up at the million mark?
I am not confident that is, I've not seen any evidence to confirm whether that is the case. I guess my assumption would be that with the cuts to services that we're now seeing because of the cost of living, I'd be very surprised if people who were providing unpaid care for loved ones during the height of the pandemic were no longer in that position now. But as I say, and I think some of the challenges around people identifying as an unpaid carer, and so the estimates are always just that, I think.
Okay. Moving on to paragraph 20, you tell us in your statement that people can share experiences with Alliance through surveys, focus groups and events. And I'm particularly interested in the early stages of the pandemic in kind of March 2020 and the remainder of that first 6 months. Did you, through your role in the Alliance, become aware of the experiences and the impacts on unpaid carers?
Yes, very much so.
And can you give us some kind of practical examples of what impacts were being felt?
Yeah, I mean, I think I can't overstate the emotional toll, and typically people were describing anxiety and the stress of support and services stopping almost at a moment's notice, without really any engagement with the family about the implications of that, what it might mean, how they might cope. Being left to manage 24/7. It was all day, every day, I think was one quote we heard from people. So, I mean, I think it was unprecedented in that respect for people that, often You know, what we expect from people providing unpaid care is more than you would expect in any other circumstance in society, really. But during the pandemic, their rights were completely overlooked in terms of their ability to provide that level of care. You know, you would never expect anyone else to never have a break, to never be able to even, you know, have a break overnight. And it was that level of expectation that was just thrown upon people.
In terms of putting aside funding, a lot of care will be paid for publicly, but in terms of, you said that support services stopped without a moment's notice, I think is what I'd noted you saying. Was that services that were provided publicly, ignoring the issue of funding, provided publicly by local authorities or other bodies, and or did that include third-party support services by, I suppose, some of the organisations that are members of Alliance?
I would say more the former of those two options from what we gathered from people. And I would also say that not everyone's care packages were stopped. And for some people where those services were stopped, it was by personal choice. It was maybe families saying we didn't feel safe having as many you know, other people coming in and out of the house, or you know, I noticed that one person had also said that, you know, it was their personal assistant who said they didn't feel comfortable being themselves put at risk. So there were different reasons why people, why that care and support stopped, but predominantly what we heard was it was about that statutory level provision. So through a local government assessment about someone's eligibility for care and support, and that being stopped. In addition to that, you know, like respite services were all stopped. You know, daycare kind of provision was stopped. To an extent, that will have affected the kinds of organisations that we represent in the third sector. If that you know, if that contract was delivered through a contract that required that. However, what we did hear often was that where support was provided, it was often through community groups, organisations, you know, third sector activity that was able to respond, not as an essential service, but more through you know, community engagement, outreach, you know, people adapting to provide support because other services were stopped.
Thank you. So am I correct that essentially family members, unpaid carers, not necessarily family, I suppose could be friends, unpaid carers and the third sector, were they picking up the slack where the public sector wasn't providing that level of service that had been providing prior to the pandemic?
Yes, and we heard that you know, frequently from you know, so from individuals who would say, you know, I'm just so grateful for, you know, whatever, you know, the local carer centre, for that particular organisation, for being able to, you know, to be a lifeline and to be able to kind of support me when other services were stopped. And we also saw it in the evidence from members, so from the organisations and the groups. When we were engaging, we were asking about case studies, how are you responding? You know, there was a huge amount of activity where organisations were trying to adjust and adapt what they were offering within the guidelines so that they could continue to offer support.
And I suppose that would have been at a time, I think you mentioned this in your statement, where organisations were finding fundraising more difficult and attracting volunteers more difficult just simply because of the pandemic. It's not possible to obviously stand on the street corner and hope to get the same kind of level of support. Is that fair to say?
Yeah, we did. You know, the financial pressures on organisations, you know, definitely came across quite strongly from you know, the members we engaged with, around fundraising, like you say. You know, their usual activity that they weren't able to, you know, to carry out.
Such like.
Exactly, and like, you know, charity shops. What I would say though is that they also, you know, there was some positive feedback about the funding that was available and made available, you know, quite quickly by Scottish Government that was there to respond to those circumstances.
Right. And I'll come on to the flexibility in funding, but perhaps you deal with that later in your statement. Moving on to paragraph 22 of your statement, you tell us about an online event held during the 2022 Carers Parliament. Could you tell us what was the 2022 Carers Parliament? What type of event was that?
So the Carers Parliament is it's an annual event for people who are unpaid carers, to almost like an assembly, if you will, an opportunity for dialogue, for debate, for highlighting the issues. My understanding is it was held in response. I think it was maybe a decade or so ago when this issue around the overlooking of unpaid carers and their contribution, their needs, their rights, and it was something which the government supported the establishment of, just to allow that kind of engagement.
I know you tell us it's online. Would normally, out with the pandemic, would that have been an in-person event?
Yeah, that's my understanding.
Okay. And you say that the event was looking at, amongst other things, challenges facing unpaid carers and families who were at higher risk of contracting COVID, and you tell us that those people felt that they were being overlooked, I think, your word, in decisions being taken as restrictions eased. Can you tell me what you mean by overlooked?
So the experiences that people described were that the specifics of their circumstances were not being, they didn't feel that those were being taken into account and were being considered in the decisions about easing restrictions. So it was both examples were given around a lack of information that would help to explain to people if you were at greater risk, and that required you to be shielding, or that required you to take additional precautions during the pandemic. What might this mean now that restrictions are easing? What are the kinds of needs and the protections that people might require so that they feel safe and informed about taking advantage of the easing of those restrictions? And I think it was generally, and I think there was also a feeling that there was a greater priority being given to trying to get things back to as much of a normal as possible, overlooking the fact that for many people continuing to provide unpaid care, and for the people that they're caring for, that wasn't going to be possible. So I think it was both in that sense of their particular circumstances, the value that we place on them, and their needs and their rights being overlooked, but also just in terms of, well, how do we need to create some flexibility and some adaptations to make sure that they can also enjoy the easing of restrictions.
Okay. Thank you. And that maybe ties into what you tell us in paragraph 23, that you say that carers and families felt a lack of support from local authorities and health and social care partnerships. Do you know what the particular support that the carers felt that was missing?
Yeah, I mean, the most frequently mentioned support was respite. There were so many examples where people were just saying, I don't know how I can continue coping with the amount of responsibility placed on me, just no breaks, no ability, no downtime, the impact in terms of the stress, the pressure on family dynamic. I mean, this is families we're talking about. These are relationships ultimately. So whilst a person is maybe also managing rotas, medications, prescriptions, helping to kind of move a person when they need that, all of those things. It's a loved one. It's a husband, a wife, a son, a daughter. So I think it was respite was the most frequently. But in addition to that, there was also frequently mentioned what people described as a kind of blanket policy in terms of the way in which services were stopped, so that the COVID response could be prioritised, and not taking account of the implications of that. you know, so for some people that might be, you know, a loved one who has a real need to continue with quite a regular routine to help them with managing their well-being. And once that routine was stopped, it really impacted and deteriorated, you know, that person's well-being. For other people, it was about being able to access, you know, consultant support or you know, a medical appointment about another long-term condition that they're living with, and the implications of that meaning that their health was worsening. And I think a lot of the time people were describing, you know, whilst they understood the priority that had to be given to the COVID response, that blanket approach meant that it was having quite a severe impact for some people, and that felt like it was being overlooked.
Thank you. And that, I mean, you say that the difficulty getting medical appointments, health worsening, well-being deteriorated. That kind of ties in with what you say at paragraph 26, that you say the Alliance has heard from unpaid carers who had experienced a deterioration in physical health. When you talk about a deterioration in physical health, is it of the carer, is it of the person being cared for, or is it both?
Both, we heard. Yeah, we definitely heard that from both. Often what we were hearing from unpaid carers was they would tend to speak directly about a worsening of a loved one's health. When they were referring maybe to their own health, it was more about their fears about how that might impact on their ability to continue to care. One example where a person said it was in relation to their mum who had been experiencing pain, and they finally got to the bottom of the issue, which was that they didn't want to seek help in case it meant they would be admitted into hospital because she was the carer of her husband who had dementia. So it was that kind of, you know, trying to really balance some of those competing priorities.
I mean, without generalising, and I don't mean to generalise, but in terms of the types of deterioration, I suppose, or the well-being, did it tend to be the person that was being cared for, it was a deterioration in their physical health, and for the carer it tended to be a mental health deterioration, or is it not possible to generalise like that?
Not necessarily.
Oh, well, I won't press the issue.
I think we definitely saw both.
Okay. And in terms of the difficulty getting medical appointments, was that primary care, you know, GPs, or did that tend to be the inability to go into hospital, or is that a combination of both again? Yeah,
a combination of both. We heard examples of all kinds of services that people you know, were reliant on or typically had. I guess the difference with general practice is that you know, usually the way in which people would have an appointment is they would, you know, have an arising issue and they would then contact. You don't tend to have kind of pre-scheduled appointments with your GP, although that's not the case, you know, for every circumstance. Whereas for other people it might be that they had you know, they had a referral for a particular area of inquiry, or they were expecting you know, some surgery, they were expecting an outpatient appointment and that had been stopped, or it might just be a more regular kind of health service that they maybe had annual checkups and or maybe physio appointments and such like that had been cut.
You mentioned earlier in your evidence community link workers, and you deal with that briefly at paragraph 36. You tell us in paragraph 36 of your statement that Alliance's community link practitioners were approached by unpaid carers who were struggling. Who are community link practitioners?
So it's a role which often is based, not solely, but is often based within a general practice setting. So the Alliance's Community Links Worker Service or Community Links Practitioner Service operates within Glasgow City and Western Bartonshire. All of those Community Links practitioners will be located at least one, but maybe over a couple of general practices. Their role is to provide one-to-one support to people where their health and well-being might be impacted by the social determinants of health, and They provide one-to-one support, but they also provide signposting. They help to refer people into community groups and organisations, and they also often encourage community groups and community responses to develop as well.
And you go on at paragraph 37 to provide various quotes that carers told us about their experiences of health and well-being in the pandemic. And I don't propose to read those all through, but we see in the first quote, a person states that they suddenly became a carer on top of our other family responsibilities. The second quote states that information was not easy to access. In terms of information, are we talking about guidance that was being issued by the government? Is that principally what, or was it local authorities?
It was a mix. There were examples where people were saying, I just didn't know what was available. I didn't know, one person described they'd come across a hospital at home programme in their area. They were just fortunate that they came across that, but they were saying, well, I'm sure there's many people who just wouldn't have been aware that that was such a thing. How do you know what to ask for if you don't know what is available? In addition to that, it was, when might things be available again? So if services have been cut, how long will that be for? What decision making will be taken about when they can resume? The same from local government as well, around social care provision. Less so. I'm not. I can't think of as many occasions where it was more that national guidance. I think it was more about the particularities about how that guidance might affect a person's circumstance in practice, if that makes sense.
So is that a lack of clarity in the guidance, or?
Yeah. So I think often there was the translation of that guidance into what this means in practice was quite difficult for people to uncover. And, so what will that mean in terms of the services I can access? What will that mean in terms of the risks I'm at?
The quotes go on to say, the third quote states there was difficulties or delays trying to contact officials. I presume is that within local authorities, or perhaps you don't know?
Where was that?
Sorry, it's the third quote at the foot of the foot of the page that paragraph 37 starts on. Sorry, my copy isn't page numbered.
Is it that you don't know where you are in the queue? Is it that one?
I'm not going to dwell on it.
Okay, sorry.
Paragraph 38, you state that the Alliance commissioned research about certain groups of people, including carers, accessing healthcare. When was that research undertaken? Do you remember?
I believe it was in 2021.
Okay. And we see at paragraph 39 that the research found that communication of the closure of healthcare services, which you were alluding to there, was poor. From the point of view of lessons learned, what could have been done better?
The kinds of things that people were describing would have been helpful was to have some single point of contact within the health service or kind of across health and social care that would help them to navigate their particular circumstances. So that piece of research was particularly around families with a disabled child or young person who had kind of varying health needs and circumstances that they felt had not been taken into account, and they'd felt pretty left without much information. So something around kind of that information, a single person you could contact that would be able to help you to find out what does this mean, when will the services resume.
And when you say a single point of contact, and again, I'm not trying to put words in your mouth, but are you talking about a name, an email address rather than mail at, whatever, a phone number, a direct phone number rather than you get through to a queuing system, press 1 for this and press 2 for that? Is that what people were looking for?
I think it was a bit more proactive than that. So someone who would take it as their responsibility to help that person navigate their way through the health service. I mean, it's not untypical for us to hear people describe the health service as quite an opaque and quite a complex set of services to try and navigate their way through. And that need for someone to help them with that coordination, with that follow up, with that much more person-centred approach.
Moving on to paragraph 41, you tell us that the closure of healthcare services had negative impacts on the health of children. I know we're maybe not dealing directly with unpaid carers, but you say despite the support from carers. Are those negative impacts, were they short-lived or did they become chronic?
Yeah, for some, they definitely described the consequences being chronic. So there was, one example where the lack of treatment for the child in question had meant that there'd been a deterioration which would no longer be able to be improved upon. So, for some people that was, it was, pretty, life-changing consequences.
Without naming any names, can you give us any examples, perhaps, if you can recall?
I wouldn't want to get this wrong, but my recollection was that it was around joint care and pain that was being experienced, and the treatment which helped to prevent the kind of inflammation that made their mobility more improved had been stopped for such a long period of time that I think there'd been kind of some fusion around the joints, which meant that wouldn't have been able to undo. It was
irreversible, essentially.
Yeah, exactly.
Paragraph 43, and I think it's the point you were maybe making just moments ago, you say that access to social care support was achieved through informal conversations rather than social workers. You identified this was shared with the Scottish Government and Social Work Scotland. Did that cause any change in the Practices Alliance contacting the Scottish Government and Social Work Scotland?
I'm not confident to answer that one.
Okay. I suppose in a similar vein, at paragraph 47, you indicate there was a lack of support from local authorities and also the health and social care partnerships. You've discussed respite. Mm-hmm. Other than respite and people being able to contact them, was there particular services that were needed that weren't available?
Mm-hmm. The other one that was often mentioned was the kind of daycare or provision for people, which was activities, support for during the day. So not overnight stays, but things that people were quite reliant on in terms of social connection and meaningful activity that had been stopped. And we definitely heard from quite a few people who were saying that that had a really negative impact for the whole family, but particularly for the person where they were quite reliant on that usual routine, on seeing friends, that had been such a core part of their routine. And not having that, the isolation had been really difficult for families.
In terms of when we deal with respite, I don't think this would be challenged. That offers advantages to both the carer and the person who's being cared for. Can the same be said for these daycare services? Are those short breaks, are they good for the well-being of the carer?
Yeah, I would. I think there are examples where they can be supported for both people, so it might be activities that both people can benefit from. But typically, yes, I would also think that a loved one going to some daycare provision would also allow the unpaid carer some time where they're not providing that care.
And we've also heard evidence that some third-party local carer centres, I think was the term that was used, they managed to remain open during the pandemic, but other services, which in my ignorant understanding seem to be very similar, couldn't stay open. Can you shed any light on why that would be the case?
I think that was some concern that people did express to us, and I can't explain why and how those decisions were taken, other than my assumption is that So local carer centres will typically be funded by, grant funding. It's less a statutory kind of function, and that's where we saw, many third sector organisations adapting. So the local carer centres probably, and my understanding is they stayed open, but they adapted what they delivered so that it's still aligned with government guidance. They were maybe, typically in-person spaces, and instead the staff were offering those activities online, offering telephone calls, check-ins, and things like that, maybe doing outreach. I know for ourselves, our community links workers, to begin with, we're very reliant on phone calls with the people that they were supporting, and as restrictions eased, they then maybe met people outside in the community so that they could, offer a bit more of a kind of personalised response, but in line with what was allowed from the restrictions. So, but very much, I think that point was, was a common source of frustration by people, where they couldn't understand why, those services which weren't seen as essential as kind of frontline services were able to adapt and to remain open and to remain very responsive when some of that more statutory provision was stopped.
And when in person, so the local carer centres are presumably physical buildings, and the daycare centres are physical buildings. When the local carer centres started to open their doors again, perhaps with social distancing and masks and such like, did they do that before the daycare centres, or was it done kind of in tandem, in unison?
I don't think there was much coordinated planning necessarily for those. I couldn't speak to that confidently, but I know that the slow pace at which day care services and support were reopened was an issue which was flagged to us by members, and which we tried to seek guidance and information from health and social care partnerships and local authorities about when they would be reopened. And
was that a positive, a fruitful exercise? You said that you're contacting. Did that help progress things, or?
Not according to my recollection. My recollection is that it was just very slow in some of those services reopening.
Now, I don't want to. You've dealt with digital issues in your previous, when you gave evidence previously in November last year, but you do touch briefly on the issue of digital exclusion within your statement. I just really have one question. If I understand it, you're saying the disabled people have had issue with the Near Me service that's provided by a lot of public bodies. Is there an alternative to Near Me that you're aware of?
For accessing appointments and services online, my understanding is that is the contract provider for the digital services which people can access for the health service, social care. I think it's a kind of national contract. What I would say is that the issues that tended to be raised with us about the platform was, I think, more about the process around it and the support available that would allow people to be able to access it confidently, and also some of the issues around maybe communication needs, and how inclusive the understanding of the NHS and social care services are around people's communication requirements, with regards to a whole range of accessing services, but particularly in a digital space. If a person has hearing loss or sight loss, taking those things into account when that option is being provided to a person.
At paragraph 82, you state that some local authorities suspended their complaint services. Do you know why complaint services were suspended during the pandemic by the local authorities?
I mean, I can't speak for them. What we came across was that the information that was communicated to people was, people being told not to submit a complaint if it was about a service that they would, usually have experienced or a disruption to a service because of the pandemic. So people being actively discouraged from submitting a complaint. I can't recall how we came across that, whether it was alerted to us by a member or whether it was something we came across on a website. But either way, it was a concern for us that was the information being communicated to people.
And why? It might seem obvious, but why was that a concern?
Even in a pandemic, people have rights. Especially in a pandemic, people have rights. And I think this was a thread that kept arising for us, was that the rights of people accessing social care, accessing health services, the rights of unpaid carers were not being taken into account enough when decisions were being taken about which services were being stopped, how decisions were being taken about which were being stopped, and the lack of transparency around them. So, being able to complain and have your rights redressed is a really fundamental component of people's human rights. So the fact that complaint process might have been stopped, was a real concern.
Moving forward to paragraphs 88 and 89, you discuss home care funding and state that local authorities are now spending twice as much for in-house spending as before the pandemic. Can you just tell us briefly what home care funding is and why those in-house costs have doubled since the pandemic?
Yes, so this refers to the, there's the National Care Home Contract, which is the arrangement through which, when a person is entitled to a state-funded care home place, that's the rate at which that place in a care home will be paid at. If you're self-funding, so if you're having to fund that through your own pocket, then the care home can set that rate themselves according to what they feel the actual cost of the care is. And from research which Scottish Care have conducted, the difference between whether it's a state-funded place or a self-funded place is around double now. So you're likely to pay twice as much if you self-fund than a person the state would be paying for a person where it's a state-funded place.
And what are the implications of that in the long run?
Well, what we are seeing is that care homes are in a position where they can't afford to take on as many state-funded places as those that are being self-funded, because it's a loss. They're not meeting the costs of care. To actually adequately manage the care home, and I've also heard that it has led to situations where a care home is only able to get funding to borrow the costs of setting up a care home if it's going to be with self-funded places, because it's a much more profitable model. So it kind of costs out people who are on, who have lower wealth and people who maybe are at that level where they should be getting state support to be able to meet their care needs.
So is that similar to the kind of anecdotal evidence we hear about dentists currently, that they need to take on more private because the NHS essentially charges aren't being sufficient? It's the same with care homes,
yes.
Is that
yes.
essentially? You mention at paragraph 92 that the many third-party health and social care organisations closed at the beginning of the pandemic. We've talked about fundraising. In terms of those organisations, have they reopened post-pandemic, or have they essentially permanently closed their doors? Or it might be a bit of one and a bit of the other. But
yeah, I think it's been both. you know, we have heard of some organisations that have, you know, that have had to wind up, that are no longer operating. We have also heard of organisations where they have had to rely more on their reserves. We have, you know, we also have heard of huge pressures and stresses that organisations are facing because of the higher costs of, you know, maintaining a building, operating a service, but at the same time as contract levels staying at the same level or sometimes being cut, and just really finding, you know, the financial environment extremely challenging to operate in.
The third-party organisations which have required to permanently close their doors, have the services that they previously provided, has that created a gap, or is that gap being filled by either the public sector or by other third-party organisations?
I'm not fully confident about that, but my guess would be a bit of both. I think at times, you know, depending on the part of the country you're in, you know, some parts of the country will have better provision. I think, you know, there are parts, you know, of Scotland which maybe don't have as much, you know, third sector provision, and therefore if one organisation closes there might not be another that can support and fill that unmet need, but in other cases there will be some who will, you know, respond and identify that, and in some ways that is what the purpose of the third sector is there to do. It's to identify, you know, issues, unmet need, you know, social issues that are not being addressed elsewhere, and to respond by developing a programme, an approach, services that fill that gap.
Okay. And I think I said third party, my apologies, I meant to say third sector. Finally, at paragraphs 100 and 101, you identified during the pandemic that the Scottish Government allowed local authorities and other bodies more flexibility with funding, and you speak positively about that in your statement. I suppose, just in terms of, has that flexibility continued post-pandemic?
No.
No. Do you want to say more than no?
Sadly, it's not just that it hasn't continued, it's actually gone backwards. I have worked at the Alliance for over 10 years, and I can't remember a harder time than now to operate in the sector. There is huge delays to decisions being given about grant funding, you know, delays that are now running into an organisation's new financial year. There's been no uplift to grants for the last 2 years at least, despite the cost of living pressures on organisations, and yet at the same time, there's higher expectations on organisations in terms of a fair work agenda. So it's a perfect storm. There's no additional money to meet those, and you know, staff are all facing higher costs in their own lives, but organisations are now being required to find that money somehow within their reserves or elsewhere, and I think it's a really challenging environment at the moment. I can't overstate that enough.
And that's the funding, in terms of the flexibility, has it gone back to ring fencing essentially of the monies that is available?
Yes, it has done. Ring fencing, you know, I've also heard at a local level of examples where contracts have been retendered but at a lower level than currently was the case, and you know, some of the providers just being in a position where they just can't afford to deliver on that basis. So it's both within grant funding and within contracts as well.
Before I thank you simply for your time again, I think Mr. Gale thanked you a number of months ago, and I think one of his last questions was to you that you don't regard this as the end of the process. He's proven that was right by you kindly coming back and speaking to us. But is there anything else you'd like to tell the inquiry today that you think might be relevant, particularly with relation to unpaid carers?
I think the things that kept being repeated to us by unpaid carers was their recognition that the role of unpaid carers is just so overlooked in society. There are more people providing unpaid care in Scotland than there are paid carers within the social care workforce. It's something which people hugely value in their lives. This is, it's family members, it's loved ones, it's friends that people are caring for. It's not that their concern is. It's the fact that their rights are so repeatedly overlooked. One person shared an example about when you look at the amount of financial investment through the social security system that's provided for unpaid carers, it's something like 37p an hour that people are being provided with to enable them to live a life for the role that they're performing. It was the fact that their visitation rights with, their loved ones was completely overlooked, even when it meant that their loved one was in distress because they were so reliant on their family member, their unpaid carer. It wasn't just in care homes, it was in hospital visits, it was maybe people in a kind of longer term mental health care provision. The fact that they felt that the role of unpaid carers was just not understood by, frequently by health and social care professionals. Their expertise, their knowledge of the person that they care for, their knowledge in terms of the caring role they perform was not being sought. They felt very undervalued. And I think one of the things that really concerns me now is in the current financial crisis, we're seeing that still. We're seeing examples where services are being cut at a moment's notice with no engagement, no dialogue with people about the implications of that. I don't see any evidence that we are learning from that experience, and it's something that we should have a greater sense of urgency around it. It is a moral outrage, in my opinion, that we continue to allow this to happen.
Thank you very much for your time, Mrs. Redmond. I have no further questions. Well, there's no further witnesses this afternoon.
Yep, that's correct. All that remains for me is to say thank you, Mrs. Redmond, I beg your pardon, and 9:45 tomorrow morning. Thank you.
Obliged.